topics and opinions expressed in the following show are solely those of the hosts and their guests and not those of W4CY Radio, its employees, or affiliates. We make no recommendations or endorsements for radio show programs, services, or products mentioned on air or on our web. No liability, explicit or implied, shall be extended to W4CY Radio or its employees or affiliates. Any questions or comments should be directed to those show hosts. Thank you for choosing W4CY Radio.
Welcome to the Ask the Expert show on W4CY Radio and Talk4 TV, where we bring you educational information from top local experts in the fields of legal, health, financial, and home improvement. Now sit back and listen to experts in family law, association law, hearing loss, business brokers, home care, along with many other topics. Now here are your hosts, Steve-O and Sophia.
Hey, good afternoon, Houston. Welcome to another Ask the Expert show. You know, when I do Houston, a lot of you might not know that I lived in Houston for like 12 years. And I love Houston. I miss Houston. And every time, the last Wednesday of the month is always our Houston show with Dr. Van Slate. And I always think about Houston whenever I do his shows. And this is a great show. I got to tell you, if you are interested in cosmetic dentistry, I got to tell you, Dr. Van Slate at Augusta Drive Dental Care, he is so innovative. He is so far ahead of everyone. He's always got the top techniques there are in the industry. And I got to tell you, if you don't like pain, that's really good because it seems like everything they do is that we have less pain. Good afternoon, Dr. Van Slate.
Wow, Steve-O, how are you doing? It's good to see you.
Is that true that the newer the innovations that come out, the less painful?
Well, you know what? I will tell you this. I think as a whole, dentistry, the whole game has changed dentistry, where I don't think it's a horrible, painful experience like it probably was, 20 or 30 years ago. I mean, it really,
yes,
everything is improved, which is great for all of us.
You know, we got two texts in right before the show, one wanting to know how long the show was. The other one is they have dentures, and he wants to know why his gums get swollen and painful when he's wearing dentures.
Oh, well, that's an easy one. I mean, all it is that a lot of times the denture, because it moves and it floats basically over the gum tissue. Gum tissue, you got to realize over a lifetime, the bone that underlies it is going to resorb and it's going to change all the time. And so a denture that might have fit very well 3 years ago, as the bone underneath the denture and the gums that surround it, as that changes, the fit of the denture is going to change. And if it starts to get a little play in that denture, it's going to cause irritation. So you really do have to go in and get dentures relined or refitted to make sure that doesn't happen.
I know you do that in the office, don't you?
Sure.
Yes. So, Dr. Van Slate, tell everybody about your practice.
Well, I'm a general dentist. I practice kind of on the west side of the Galleria area in Houston, but I do all sorts of dentistry. And, of course, what I love doing is the cosmetic aspect, as you know, but we do everything from TMJ. We do a lot of that in our practice. We do sleep, we do implants, we do, most of the things you would expect a general dentist to do, including root canal. So we do it all.
I saw a lady on TV the other night, and I don't know if this makes sense or not, but her teeth look too white. Is that possible?
Well, it is. And hopefully we'll get a chance to visit with that, because there's ways to avoid that. But that's a big pet peeve of mine, because it just doesn't look natural, as you just pointed out. Teeth should look natural.
It did not look natural.
No. Teeth should look natural. And there's ways that we take long links to make sure that happens.
Well, let's talk about tooth bleaching.
Sure. Well, as far as tooth bleaching is concerned, this is what I would tell you about tooth bleaching. As you well know, Bleaching is all over the place now. It seems like you can't open up a magazine or get on the TV and watch TV without a commercial talking about tooth bleaching now. So it's out there. And what I will tell you is most of the bleaching that you find, even the over-the-counter ones, they use hydrogen peroxide and carbamate peroxide, which is exactly what we use here in the dental office. The big difference, though, Steve, that I can tell you is that it's the concentration amount, it's the potency that we use in the dental office that usually is going to be at a level where we can achieve results. We can get the teeth lighter quicker, and they can last longer because our bleach will penetrate the teeth to a deeper amount. So the key is, you really want to, if you want to think about longevity, I think that's where we can still come in the dental office and have that experience here as opposed to what you can get anywhere else. But I will tell you the true secret, though, Steve, to any kind of bleaching. Most people just have to realize that it doesn't matter how you bleach your teeth or where you have. You might be pleased with the bleach, but you have to touch up periodically with the bleach. It's not a one-time and it lasts forever. Most of the people that I have seen that are really good at having lighter teeth, what they do is they may come to us and really get a good jump start and getting their teeth lightened. And then every 3 or 4 months, they'll have a system or a way to bleach their teeth for a few nights, maybe 15 minutes a day, where they maintain that smile. Because in our diets right now, in the Western diet, I mean, there's so many things that work against us with the color of our teeth. And the big ones are going to be black coffee, red wine,
Yes,
fruit juices, soy sauce. Of course, smoking is a huge deal. But all those things, anything, if you think about it, anything that's going to stain a white t-shirt is going to really wreak havoc on your teeth too. So because of that, you have to touch up with the bleach. And so that's
Barb in Galveston wants to know, what do you think about trays? And if I do bleaching, how long does it last?
Okay. Well, that's I will tell you everybody that we do bleaching in the office with, we make a set of trays for them to wear at home. Okay. Trays can be very effective. You don't have to do it in the dental office, okay, under a lamp or anything like that, or under a laser. You can do this effectively at home. It may just take a little longer to achieve those results. So I'm a big fan of tray bleaching, but we make bleaching trays for everybody. And the bleaching tray, in case people don't know, it looks just like this, okay, and they're soft. But what a bleaching tray does is you place the bleach, and you usually wear those for about 15 minutes a day. And that's how you either maintain a smile or try to correct a smile that might be darker than you'd like.
Interesting. What about now? Can bleaching be harmful to your teeth?
That's a great question, Steve. And this is what I'll tell you. Out of 25 plus years of doing bleaching in my office, I've never had a case where it's caused irreversible harm to the teeth. Probably the biggest deal with bleaching would be more sensitivity. That can happen. And what I will tell you, if you have sensitive teeth just in general, you're probably going to have some sensitivity bleaching them, okay? If you have gum recession, where some of the roots of the teeth are showing, those people have a tendency to have more sensitivity. But we usually have something called relief gel that we apply to the teeth to help with any sensitivity in the office. And then we also have a relief gel that people can take home and use those while they're bleaching, just to keep the teeth where it'll soothe. But the important part, the takeaway there, is that it's not a long-term thing. You might have temporary sensitivity, and then it'll get better. And I think this might be a good time. Another thing that I'll tell people about bleaching, I mean, what we're trying to do with bleaching is obviously get lighter teeth. Well, somebody has a lot of silver fillings in their mouth, especially on the lower teeth, it will detract from a smile every time. So sometimes, if you have a lot of silver fillings, you want to get those taken out and replaced with a tooth colored filling. And that'll make a big difference just on its own. And I guess another thing you always got to think about is the gums, right? Because gums that are red and inflamed are going to detract from the brightness of a smile. And, I know we've talked about this on the show before, Steve, but people think that they need to get a cleaning done every 6 months because that's what insurance will cover, right? Well, the problem with that is it's not based on any scientific evidence, because what we realize is that really, if I had a perfect world, everybody really needs to get a cleaning about every 3 or 4 months, because it takes that long for the bacteria that we cleaned out to basically rebuild itself up to the pre-treatment level. And so if they're only getting them cleaned every 6 months, you might go 3 or 4 months where you have bacteria that's there to cause inflammation, gum problems, and even tooth decay. So it's a big deal.
Well, I got to tell you, we just got, I think, is the greatest question. It's from Norma in Sugarland. I am so confused, Dr. Van Slate. I see all these commercials on TV for toothpaste. This one does this for you. This one does this. This is doctor recommended. Who do you recommend for toothpaste?
Well, you know what? Here, you're putting me on the spot here, because there's so many great ones. You know, I couldn't tell you. I know that I love certain kind of lines in there, but I don't want to be boxed into any certain thing. There's so many. I'll put it this way: the Colgate lines, the Crest lines, the Sensodyne lines. These things have been around for a long time. They've been extensively tested. They are now very specific. You got some that are for gums. You got some for sensitivity. You got some for lightening, and you know, all of that works to some degree. But I would just say that if you stick to some of these major ones like that, you're gonna have great results. They're all good. I can't say that any of those would go wrong.
That's a great answer, because it is confusing. I mean, to the consumer,
Yeah.
because we hear everything under the sun, and basically what you're saying is that the top 3 brands are good.
Oh, they're absolutely good. You cannot go wrong there. And there's a lot of other good ones. You know, there's some on the more holistic realm. But you know, the bottom line is those are really great toothpaste.
Now, let me get back to bleaching. Is that the only way to improve someone's teeth? Is with the way you do it?
Bleaching will address, you know, purely color issues, Steve. But you know, when we're talking about a smile, and we're talking about how do you change a smile or give somebody that beautiful smile that they're going to be so proud of. And I guess the best way to talk about this is people have to know what a beautiful smile looks like. What I do in my practice, I take a lot of photographs, and I look at that picture, and I can say what makes a pleasing smile to me. Number one is color. People have to realize that teeth are not monochromatic. Maybe you were telling me that those teeth look fake. They look too light earlier in the show. Well, teeth are a blend of colors. They're not one color. And so part of making that natural is you want a blended tooth color. Number two, you never want to see a smile that has a lot of spaces or gaps or rotations, right? I mean, pleasing smile, usually the teeth are going to be straight in appearance. Number three, tooth wear. You don't want to see teeth that are flat on the edges. That is always going to detract. And there's something that we call the golden proportion in dentistry. The width of the tooth should be about 75% of the length. So if the tooth is too wide on the bottom, then you're going to have a square looking tooth. If it's too short, it's going to look too long. Both of those detract from a smile. And so, and then another thing, whenever I look at teeth, Steve, the two centrals, the ones in the very front, they should be mirror images of each other. If they're not, it's always going to look different or bad. And then I think these next two, when I show this picture, that's a really good looking smile right there.
Yes.
Okay. These are veneers. Okay. But what I want you to really pay attention to, when you look at this, is the corridor. You don't want to see dark back in these areas. You want a nice broad smile. And then if you look at this lip design, how it's rounded, you want the teeth to follow that lip line. So what you're looking at, is proportionals, all that blends in to create a really great smile. Of all the things that are out there in our toolboxes, we basically have crowns, bonding, and veneers to create a great smile, right? Of all of those, bar none, the one that is the best by a long shot are porcelain veneers.
What are veneers, Dr. Van Slate?
Well, I'll tell you, Steve, let me just see yes. A veneer is a piece of porcelain that's about 0.5 millimeter thick that we mechanically and chemically bond to the tooth. And when we do that, here's what a veneer looks like. You can see how thin the veneer is, okay?
Wow.
So there's the front of it, and there's the side. You see how thin that is?
Yes.
Okay? So when we do a veneer, you got to realize that what I love about a veneer, it's definitely the strongest, the most durable. It's color stable. It does not change in color. I can correct anything as far as gaps. I can correct rotations in a tooth. I can make a mirror. I can do all the proportions. I can correct everything with a porcelain veneer. It's the only thing in dentistry that I know of that'll do that. And it's conservative because it's so thin. So I'm a huge fan of the veneer, and
Easy to work with.
What's that?
Easy to work with.
They're very easy to work with. And the key, don't let anybody fool you. It's not always the dentist. It's not always me that does the great job. You have to have a great lab, and you've got to really have great communication with that lab. And I'm very fortunate. I've worked with a lab for over 20 years that has delivered for me time and time again. They're out in California, but what these people do for me is mind-blowing. What they do, they are really the true artists that do what I do. And the way I communicate with them is I have that digital scanner. I think that we showed on the show last week. I use a digital scanner, and then they can do what's called a wax up. This is a wax up, okay? You can see how nice the teeth look there. Yes. What we do is the lab will do the wax up, and they can make these little guides. I call them Pret guides that show me exactly where the teeth need to be adjusted. It basically, it's like doing the case before I do the case. It also can show the patient exactly what their teeth are going to look like, and I can show them befores and afters. So it's an incredible way to communicate. But the bottom line is the lab, you've got to have a great lab, and there's got to be great communication, and all that has to be worked out before I work on the tooth. And if we can get all that, we'll have a great result.
I got to bring something up that I don't even know if I've told you this, but it is so important. One of the main things you do are dental implants.
We do a lot of dental. We restore a ton of implants.
You do a lot of dental implants. And I got to tell you, it is the one thing that changes your life, Dr. Van Slate.
Sure.
I actually have implants myself, and I know women are different than men. Women who are missing teeth, it really affects their smile.
Sure.
And man, probably it affected mine too.
Sure.
But I got to tell you, once you've had implants done, it literally changes your whole life.
It will. As far as, if you're missing teeth, the implant is the best thing to give you the function and the feel that a natural tooth will give. There's nothing else like a dental implant. So yeah, we do dental implants in conjunction with our veneer and cosmetic cases quite a bit, so that we can kind of tie in the implants with the overall cosmetic picture that we're trying to achieve. It's a great restoration.
You see this all the time. People are missing teeth, and you do the dental implants and you put them in, and they must have the biggest smile on their face.
Well, I tell you what, it can be very rewarding when you change a person's outlook and a feel. And I just look at the case I was showing you. This is somebody that came in before. You can see what they look like, right?
Oh my gosh.
Well, this is what we achieved. Now, you don't tell me, you think that'll make a change for somebody?
Oh,
you're talking about a guy that never wanted to even show his teeth. Now he's smiling all the time. That is what we can do with cosmetic dentistry and dental implants, or even without dental implants. If you just do this kind of dentistry, it is the most rewarding thing that I can do.
It is. I guess the best way to put it is totally a game changer. I guess that's the best way to put it.
Well, it'll change people's lives, Steve. It literally will change people's lives.
Exactly. Tell me some of the other areas of cosmetic dentistry that you've gotten into.
Well, again, veneers are the most phenomenal. I mean, we just went over the really big ones. I think that, if you talk about cosmetics, though, another really, really important thing that you really want to not avoid is the gum tissue, because the gum tissue is the foundation of the teeth, right? So
Yes.
I couldn't live without my dental laser when I'm doing these cosmetic things, because a lot of times I need to sculpt the gum tissue. In other words, if the gum is lower on one tooth,
I never thought
you've got to
that.
sculpt it, and the laser is just a piece of the puzzle that you cannot avoid. I do it with almost every veneer case that I do and cosmetic case. And when some people, when they smile, they show a lot of gum tissue.
Yes.
We call it. And these people, sometimes it's a growth thing. Their bone has grown down and forward a little bit, and so they show more gums than they like. And what we have to decide before we do a cosmetic case, do these people need to have something called crown lengthening, where we can actually remove a little bone and lift the gum tissue before we do the veneers? And that can be a huge deal for a lot of people. You can really enhance a smile just doing those kind of things. So that's another thing that we do. But it's huge. And then, of course, we've talked a lot about Invisalign on our shows. And I do the interesting thing about Invisalign, Steve, is I can do Invisalign in conjunction with my cosmetic cases, because if I have a person that comes in with a lot of crowding, the beauty of Invisalign now is I can maybe put some Invisalign trays on, and in 4 or 5 months, love and align those teeth so that I have a much better foundation to work on, less crowding, so less reduction on the teeth, and it can really enhance what I'm doing cosmetically. So I love doing those kind of cases as well.
Grace in Sugarland she said, I love what I've heard about dental implants. My only problem is, how much work would I miss?
With dental implants?
Yes.
Okay. It really varies. Okay. That's almost a trick question, because if you're getting one dental implant, you shouldn't miss any time. It's not any different almost than getting a filling done, really, honestly. You shouldn't miss any.
Okay.
Now, if it's a situation where you're having multiple implants and multiple extractions, then yeah, you might have to take maybe a week off or so to heal to the comfort level where you can go out there and do what you do. So it varies case to case, person to person, and the extent with what you're doing.
John, your show always goes by so fast. Tell people how they can call and make an appointment with you.
Sure. Well, to make an appointment with me, the number is 713-783-1993. That's 713-783-1993. And, anybody that wants to come, hey, we're always happy to see anybody that wants to come see us.
Hey, John, do you have a website?
Yes, drvanslate.com.
VANSLATE. Very good. John, I know we're going to be doing a replay next month.
Yep.
We won't see you, so have a wonderful and blessed Thanksgiving.
You too, Steve. All right, buddy. Have a great day, okay?
We'll be back with we'll still have John's show at the end of November, the last Wednesday at 4:00 in Houston. Thanks, John.
All right, Steve. Have a great day. Bye-bye.
You too. That's John Van Slate, Dr. John Van Slate. God, he's been with us for several years. We're going to go to a quick break, and we'll be right back for our Dallas show.
And we are back with the Ask the Expert show on W4CY Radio and Talk4 TV with your hosts, Steve-O, Sophia, and their expert guests.
And that was a quick one. Hello, Dallas. Welcome to the Ask the Expert show, where we bring you the top experts in the field of legal, health, financial, and home improvement. We have a great show for you. You people who are trying to lose weight, this is the greatest show. And maybe you might have some other problems also, health problems. And I bet you we might even discuss those today. Do we have Dr. Gamboa with us?
We do not yet.
Okay, we're waiting on Dr. Gamboa. Dr. Gamboa she has a practice in Grapevine, Texas, and it's called Elite Care. Dr. Gamboa is In fact, we've already actually had several people contact her. She is not taking on new patients until the first of the year. I wanted because we
Dr.
had,
Gambo is here.
oh, good. She's here with us.
Hello.
Hi, Dr. Gamboa.
How are you, Steve?
I'm wonderful. I was just telling, we've already had two people call your office and they were told you're not taking on any new patients until January. Hey, you're going to have to get another doctor. You know that, don't you?
Yeah, like, oh my gosh, like I think I have to like go ahead and I'm looking for some like nurse practitioners, like, so
Oh,
hopefully I
yes.
can have some help. But like that's where we are. So hopefully it's going to get better.
How are you going to find somebody as sweet as you are?
Thank you, sweet. Like Steve, you're so sweet. Thank you.
Well, we love doing the show. And Dr. Gamboa, one of the things we talk about on here is weight loss. But I guess somebody went to your website and wanted me to ask you, what is Evolve?
Well, Evolve is like a machine, and it's a treatment that does three things. It has radio frequency, it has um, the EMS, that is the stimulation of your muscles, and then also does heat. So by doing that, so it kind of melts the fat, but also it kind of helps like with your skin, and also like it tones your muscles. So it's really wonderful to do some contouring of your body whenever you're losing the weight and you have all this like a little bit of, not a lot of soft tissue, like not a lot of fatty tissue, but like whenever you have some um, extra areas in your arms, in your like abs, like a little bit of the love handles, your inner thighs. So that's great for that.
Does it tighten the skin?
Yes, it does tighten the skin. It
Oh,
does radio frequency, and then also like it helps with your muscles, and it melts the fat.
well, Dr. Gamboa, I think most of the emails we get, people want to know the different areas that you treat because you don't just do weight loss.
Right. So like I also do like hormone replacement with bioidentical hormone replacement. I do pellets. Then I also like do the general family medicine primary care, like diabetes, high blood pressure, high cholesterol, thyroid, and here and there like some little skin biopsies whenever it's not like a huge thing or anything that may be dangerous, or like a melanoma, for example. I leave those to the dermatologists. But yeah, so I do little things like that.
So, Dr. Gamboa, listen, I know people want to lose weight for physical reasons, the way they look. But I got to tell you, I have learned so much about weight gain. And when you're overweight, I mean, yes, you want to look good, but I got to tell you, it is so important when you are overweight, the things that it does to your health, right, Dr. Gamboa?
Oh yeah, like so nowadays, like it's nothing about the looks, like the all the research, everything that we've learned so far, and like COVID is the one that like put the light on this, that obesity, being overweight, like is just a risk factor, and a risk factor for so many things, chronic diseases, not only high blood pressure, high cholesterol, like then like increases for cardiovascular disease, diabetes, and also like so many cancers that are linked to obesity. So that's why we want you to be healthy. It's not that we want everyone in America to be skinny, but we want them to be healthy. And I want them, like I would love for the government, for the insurance companies to listen to us, listen to all of our
Yes.
suggestions, listen to us, and ask for all the tools that we need for our patients. And then like these are the tools, but also our government has to do better with all the chemicals, all the other things that they are putting into our food, because it's not only okay like we're going to use the medications, but also is, hey, don't feed us all these chemicals, that many of those chemicals are banned in Europe, but we have them use them here. So why do we do that to our people?
You must listen to Robert Kennedy Jr. He is so up on foods and what some of these foods are doing to us. But the thing is, and I don't mind admitting it. It seems like it's a taboo or something. Oh, did you know they're on the skinny injection? Well, I'm on the skinny injection. And I got to tell you, Dr. Gamble, I've told you I've lost 35 pounds,
That's good for
and
you. That's awesome.
my my blood work is so much better.
Yeah. Your blood work, your kidney is going to thank you, your heart is going to thank you, your joints are going to thank you. So everything is going to get better. And that's what like the insurance companies need to understand. They don't see it right away. That's why they don't cover these medications for people that they don't have diabetes. They just want to lose weight, but they want to prevent that. They have to see that. They have to prevent them to be having the diabetes, the high blood pressure, the need for all these other problems. So they have to see that. I mean, it has to be a point where all the insurance companies get together, and then again, like also if like Medicare does the first step and saying, okay, you know what, let's cover this because this is going to help Americans to get healthy, then that's going to
Yes.
be better. Medicare did something like it did get a little better for patients, but it's with limitations, of course. So they cover Wegovy, which is the weight loss medication, but you only cover it if you already had a cardiovascular um, problem. You know, if you had like a heart attack or you had a stroke, then they will cover the Wegovy. You know, I mean, it sounds a little. I don't want to
It's
sound
not,
like.
you know what, Dr. Gambo, it's not right. I don't, as a business, I'm talking about for business now, because if I was an insurance company and I could lower somebody's weight, which means they're probably not going to have a heart attack down the road or a stroke or sleep apnea or high
Exactly.
blood
Have
pressure,
to see
I'd
that.
want to take care of it now.
Yeah, and you know, in the long run, they are going to save money because guess what? They are not going to have like to pay for the CPAP machine. They're not going to have to pay for the tubings. They're not going to have to pay for the insulin if the patient gets into using insulin. They're not going to have to pay for so many things, and maybe a haircut or maybe a any other things are like a hospitalization for a stroke. You know, so we have to help the people, and that's what they have to see. You know, right now they don't see it. They just see how much money they're going to spend because of these medications are expensive, but they are not seeing it in the long run. What are the benefits that the patients are going to have? And that's what we have to think about, the benefits. And also for them, like if they like to see it as money and a business, they're going to save money in the long run, you know. But I don't know, like it's taking time. Hopefully, more and more insurance companies and employers they adopt the wellness part, because if an employer does not choose the wellness plan where they cover these medications, you can have the best plan in your company, but if your employer didn't choose that, then they're not. These medications are going to be excluded from the plan, so they're not going to be covered. So that's another thing that they have to realize that's also part of the employers, that they need to help their employees.
So we know that stress causes weight gain. How do you treat a client for stress?
You know, and that's an excellent question, and thanks for bringing that up, because all comes to, yes, stress can kill you, because what does stress do? Stress increases your cortisol levels. The cortisol
Yes.
are the ones that are going to cause all this problem, the metabolic inflammation, the insulin resistance is going to mess up the thyroid, is going to like decrease the way your white blood cells fight infection, so you're going to be sicker like more frequently. So many things. So there are so many things that we are trying to help patients with. And you know, like I do more integrative functional type of medicine, so we try to like not only helping them with the breathing exercises. It's called box breathing. You can do that. Then also like some supplements that are very good for that. So like there's some evidence that Relora, which is a magnolia derivative, that helps, and they decrease the levels of cortisol. You know. Also, there's another one that helps for anxiety. For example, is called L-theanine. This is a supplement that comes from the green tea, and that helps a lot with anxiety and irritability without making you drowsy or somnolent, so that really helps.
We just got a text from Janet in Plano. She wants to know, what hormones do you test for in women?
Oh, thank you, Janet. Like, very good question. So for women, we definitely test, and then also like um, it depends on like the age of the female, what are the symptoms that they're having, but mostly like we're going to test and see if her ovaries are working, her estrogen levels, how are they, the progesterone levels, if she was on menopause and she was on replacement already. And then definitely I test for testosterone because not everyone thinks that testosterone is needed for females, but oh yes, we need testosterone. Like testosterone is not only for guys. Like nowadays, like we have so many research and so much evidence about how testosterone helps, and all the hormones, guys and girls, we have the same, like it different amounts. Guys have like testosterone and a little bit of estrogen, and females, we have tons of estrogen and a little bit of testosterone, but we all have basically the same hormones. And those are the hormones that I test. I also test the thyroid, but I also like to test for the functional part of the thyroid. Not everyone tests for the free T3, which is the one that it's more like biologically active form of the thyroid, and that's what I like to test.
Barb, we are getting so many people wanting to know about the injection. I'm going to take one of them. Here's Barb in North Dallas. Dr. Gamboa, I love your show. I never miss one because I always learn something new each
Thank
time.
you.
Can you explain these injections that were originally supposed to take care of diabetes? I know there are several, and how do they work?
Oh, thank you so much, like for the question. So yeah, so there are different injections. Like then the most popular one, and they are called GLP-1 uh, type of like injections. Why? Because they're like agonists. That means that they are going to turn on our receptor for the GLP-1. So what does it do? It goes ahead and decreases your appetite, increases your satiety. It helps a lot. Why it was for like diabetes? Because initially they saw that it was like decreasing the amount of insulin secretion from the pancreas, and also it was helping at the level of the liver not to make too much like sugar, right? So initially, that's how they found out that they saw, okay, let's try this for the diabetes. But later, because it helped with the less appetite, more satiety, and it was helping lose weight, then they saw, oh my gosh, like this probably will work great for obesity. And that's whenever they start the research, and that's how they ended up having the medication for the obesity. But nowadays, they're like anything, everything is evolving. So initially, it was a one peptide. For example, like you are all familiar with Ozempic. Ozempic
That's what I'm on.
is the semaglutide. The peptide is called semaglutide. The branded name for diabetes is called Ozempic, and the branded name called for weight loss is Wegovy. So that's one peptide. And now, like again, like everything evolves. Like now, there's like another medication in the market that it's with two peptides that is called tirzepatide, and that's the two peptides. It's like one peptide wrapped in the other one. So it's a GLP-1 and a GIP. So this one not only helps with the appetite and the satiety, but it also helps with the insulin resistance. So it does a little bit more than the other one, and that's why it works great as well. And the branded name for diabetes is Monjaro, and the branded name for the weight loss is Zepbound. So they work great. Both of them like does wonders because internally they kind of balance out all this what I was explaining to you about the appetite, the satiety, the insulin resistance, and it helps patients. Like what I like about the semaglutide, it has a little bit more evidence in the sense of like it decreases the cardiovascular risk, strokes, heart attacks. So, but the Monjaro, because it's kind of the newer one, we are waiting for those results to come out because in order for us to know that, some time has to go by, like we have to know
Yes.
how much they're going to protect us, what else they're good for. And I was reading some like articles and then some like news in the medical news, and they're saying, oh, like this one's like the GLP-1s or the tirzepatide, grade 4 of sleep apnea. I'm like, hello, that's what we were saying, because like it's like we're going to lose weight, then it's going to get better. So the same exact thing, like, and finally, I think that they're showing more. It's like one of them, they were seeing that maybe it's good for kidney disease. Yeah, the same thing. We're like decreasing all the load from the kidneys, right? So, and I'm thinking that some of that has to do with it, but probably there are other internal mechanisms that they're finding out. But that's good because like the insurances are going to see more and more all the benefits, and they're going to be like, oh, okay, it's not only for obesity, because that's still, because obesity is not recognized as a chronic disease, they don't pay much attention to it. That's also the problem. Whenever they recognize that it's a chronic disease, then it's going to be covered.
I have not really had any side effects. Once in a while, I get a little nauseated, a little, and it goes away. Why do you think people are saying they're having these side effects with their gastro?
I think it has a lot to do on the way they're using the medication
Mm.
and also who is giving them the medication. Because this medications is not only like to get it like on a vending machine or to get it on like the mall or I don't know, like a hair salon, someone that it says, oh yeah,
Yes.
we have GLP-1s, come on, and then get it. So we have to monitor the patient very closely because also they have to know more about the medical history of the patient, because what if the patient had a history of pancreatitis, then probably he's not a candidate for this, or they have like stones in the gallbladder, then they can cause problems. So and then why do they have more nausea? It's like because also um, number one is like a lot of patients are more sensitive to that, because I see that a lot. So some patients with 0.25, that's the lowest dose, the starting point, they can have a lot of symptoms. Whereas other patients, like they have to go to 1 milligram to feel something that it's working on them. Also, it has a lot to do with the amount of food that you're eating. You're going to learn very quickly that with these medications, you have to decrease the size of your portions because you get full faster. And if you go beyond that area and that line, and you're like, oh my gosh, yes, you're gonna feel like your food is on your throat, and you need sometimes to throw up. But also, it's because this medication slow down everything. They make your food stay longer in your stomach. So depending on what you ate, sometimes you may have nausea, sometimes you may have heartburn, sometimes you may have diarrhea, because it depends on what you ate.
Here's Wendy. She actually called your office. She said, in January, I am going to become a patient of
Oh,
yours,
thank
Dr.
you.
Gambo. I
Thank you.
love your personality and your education. I want to know about bioidentical hormone injections. Your thoughts?
Like the bioidentical hormones are great because bioidentical means that the chemical structure of the hormones that we are going to give you are exactly like our own hormones. So that's why your body doesn't recognize them as foreign. We are not giving you anything synthetic. And that's why they work really good. And that's how we are seeing all the benefits with the bioidentical hormones. The hormones are showing that they decrease the risk for cardiovascular disease. They are helping to decrease the risk for dementia. They are decreasing the risk for osteoporosis. And in general, they are helping us with our quality of life, like because so many women, they suffer a lot after menopause. They start having hot flashes. They start
Yes.
having brain fog. They feel more irritable. They cannot sleep. And it's a vicious circle. You don't sleep well, you're irritable, then you get more anxiety, depression. So then what do? Like most of the people that doctors that they don't do integrative medicine, that they don't do hormone replacement, guess what they start the patients on? Antidepressants. So that's something that is very common in menopause, and unfortunately, like we have to change a little bit of that. It's like they don't have a deficiency on antidepressant, but they have a deficiency on the hormones. And don't get me wrong, like antidepressants, they have their place. They're great whenever you need them. They also for the anxiety medications, They are great whenever you need them, but you don't need them all the time and not on everyone, So we just have to see when you need them. So bioidentical hormones are being great. The injections, mostly like that one would be for the guys, the injection of the bioidentical hormone, like that's like a newer version of like a testosterone that it's like subcutaneous, like similar to the way they inject the Ozempic or the Mounjaro. Nowadays we have one that it's every week as well, and it's much better. It's called Zyosted, and you do it every week, but that's only for guys. That one doesn't, we don't have it for females. For females, the bioidentical testosterone replacement would be sublingual. We can compound it. There's a compounded cream that we use, but like the ones that are easier, and the ones that they keep the levels more like stable are the pellets. And those are like, whenever I see you, like I'll be happy to explain everything about it. And then you put it in the buttock for the females, and then we do this every 10 to 12 weeks. If you are in menopause, we also give you the pellet for the estrogen. So we put the estrogen and testosterone at the same time. And then we recommend for you to start taking some compounded bioidentical progesterone to protect your breast, to protect your uterus. And if you don't have uterus, still, it protects your breast.
Hey, Dr. Gamble, I've heard so many good things about the pellets. Are they for men and women?
Yes, so they're for men and women. For women, we need, as I was mentioning to you before, the difference in the dosages. So we need a tiny amount, kind of 10% of what the guys need. So for us, it's like smaller pellets and less dose. And we do this every 10 to 12 weeks, depending on the female, if she's very active. If she's more active, then sometimes we can do it like 8 if we need to, but mostly it's 10 to 12. For guys,
it makes you feel like a young person.
Yes, and then for guys, the pellets are a little bit bigger, like kind of like a Tic Tac, like a little bit like that, but they have like greater amount of testosterone, and we need greater doses because we do this every 20 to 24 weeks. Like more, the guys tend to use it a little bit faster because like also like it gives the energy so that they are more into the gym. They're doing more resistant exercises because also recovering the muscle mass. And that's the other thing that is very important whenever you are with the injections, because you tend to lose muscle mass. So we have to be better at good protein intake and resistant exercises.
Dr. Gambo, tell people how they can reach your office.
They can reach my office at 469-947-6020. And as we mentioned before, please be patient. I'm the solo practitioner. I don't have a help yet. Hopefully, like help is on the way. But like that's why like my appointments are right now, like for January, because it's only me.
Well, our listeners understand. They love you, and you'll be back again with us next month, Dr. Gamboa. Thank you so much.
Thank you, guys.
Have a wonderful Thanksgiving, too. I won't see you before.
Too. I won't. Bye. Take care.
Tell Harold hello for us.
I will.
That's Dr. Gamboa. She's our in-house doctor. She's fabulous. Hey, that's it for us today. We'll be back again with you next week with more Ask the Experts.
Thanks for tuning in today to the Ask the Expert show on W4CY Radio and Talk4 TV. Tune in next week and every week to hear more from our experts on personal injury, insurance, air condition repairs, estate planning, Medicare, and many other topics in the areas of legal, health, financial, and home improvement. See you next week.